Transfusion kit includes directions, 4 documentation sheets, 1 CSR wrap, 1 67-inch blood tubing with spike and filter, 1 extension set with male lure lock and female lure lock ends when using a warming device, 1 shuttle set, 1 10 milliliter syringe, 1 30 milliliter syringe, and 1 blood waste bag with Velcro hanging hooks. Remove components from packaging and follow hospital protocol. Using aseptic technique, ensure all connections are tight. Depress the plungers and the 10 milliliter and 30 milliliter syringes to expel air. Attach the blood administration set with filter by connecting the male lure lock end to the female lure lock end of port A, which is the right side of the shuttle set. Connect the 30 milliliter syringe to port B and the 10 milliliter syringe to port F. Port C is a one-way check valve to prevent possible backflow of old waste blood from entering ports A and B. Connect the waste bag to port E and hang below table level. Prime the blood administration set and the umbilical catheter following standard hospital policy and procedure. The stopcock should be in the off position towards ports E and F to close off the waste bag old blood ports. With the roller clamp closed, squeeze and release strip chamber until the solution or blood level is above the end of the filter and is 1/3 full. Open the roller clamp. Pull the 30 milliliter syringe plunger out until all of the air plus 2 to 5 milliliters of solution or blood is in the syringe. Before inserting the umbilical catheter, depress the 30 milliliter syringe plunger until all air is displaced through the catheter and discard this blood. Repeat steps B and C as needed to fully prime the lines and ensure all air is evacuated from the lines. Follow hospital procedure for insertion of the catheter into the vein. Pull back on the plunger of the 30 milliliter syringe and fill with blood for administration. Move the stopcock into the off position towards port D for the extraction of old blood. Using the 10 milliliter syringe, pull blood from the umbilical catheter into the syringe. Move the stopcock handle into the off position towards ports E and F. The stopcock should be in the off position towards ports E and F, so not to infuse the solution or blood back into the umbilical side of the system. To discard waste from the syringe, depress the 10 milliliter syringe to move into the waste bag. Infuse new blood by depressing the 30 milliliter syringe plunger. To refill the 30 milliliter syringe for further administration, pull back on the syringe plunger. Repeat steps 8 through 14 as needed to complete the procedure. Record administrations and withdrawals on the documentation sheet provided. How to perform a neonatal exchange transfusion using a single catheter setup. This device may be used with either a UAC or a UVC. The Marion Medical Exchange Transfusion Kit is streamlined with only the necessary components to perform the exchange transfusion. This tray allows for your clinicians to use the drapes, gowns, gloves, and catheters per hospital protocol. Directions are supplied to help explain the use of our components. Procedural details may vary according to clinical judgment as well as hospital policy.